I showed the money in the bank, everything's good, chugging along, and then you failed your site visit.
Wah, wah, wah. Don't do that. Hi, everyone. This is Mariam Treystman and Kelly McCarthy from the Home Health Consultant. And today we're going to be talking about CMS site visits. But first, if you like our content, please like, subscribe, and share. So let's jump right in. What is a CMS site visit? When and why does it happen? What are the surveyors looking for? And how do you make sure your agency passes?
Sure. So this is an unannounced site visit that comes to check that your agency is open and operational. This is something that is triggered through your MAC, your Medicare Administrative Contractor. In California here locally, it's NGS. And this will happen during your Medicare and Medicaid enrollment process. This is strictly a location verification. So a lot of times people will refer to this as a site survey, and it is, but I try to explain it as a site visit versus a site survey, because people hear the word survey and immediately think, oh no, there's a surveyor coming into my office and going to go through my charts and go through my HR and go through everything. And that is not what this is at all. So how agencies find out about this unannounced visit. There are certain times in your enrollment process where there is going to be an automatic trigger for these visits to happen. There are some times during the process where it is possible that you could have a site visit, and sometimes you're never going to have a site visit. Sorry, shouldn't say never. You can always have a site visit, but you do typically get an email notifying you that the site visit will be happening.
So when you say unannounced, like what do you mean by unannounced?
Like we don't know the day or time they're going to come. Once you get that email saying that you are required to have that site visit, it could happen literally any second from the time you get that email.
So to differentiate, we have a few kinds of surveys. One is a scheduled one where you know what's coming and you know what date and time or just the date that they're coming. One is unannounced, meaning you know about it, but you don't know when it's coming.
Correct.
And then there's like surprise surveys, like complaint surveys, where you don't know that it's going to happen and you don't know when they're coming.
Correct. So this is an unannounced, meaning it's that middle ground of, one's going to happen, you just don't know when it's going to happen.
Yep. So how do agencies receive this notice? Like, how are they notified that they're going to have a site visit?
So they're going to get an email from their MAC letting them know that a site visit is going to happen. This might be an email with just the site visit notification, or it might be part of a correction that they're asking for an application, and the site visit is part of that application.
Got it. And like this is specifically for Medicare applications. So when Kelly is saying with the MAC, so what are some instances of like when they will do the site visit? Like what will trigger this?
Sure. So I have seen this be triggered during an initial 855 application when there are questions surrounding the location itself. That could trigger it. It's not very common, but every once in a while you'll see it. And then you're always going to have this happen when you're applying for your provider during your third capitalization. So, as part of the third capitalization, and this is for home health. I'm specifically talking about capitalization. However, this is for anybody applying for provider, home health, or hospice. You're going to have a site visit at this time before you receive your provider. The other time this is absolutely mandatory is anytime you are changing locations. So anytime you move, they're going to confirm the new address.
Part of the enrollment process is the site visit, and there could be multiple site visits as part of the enrollment process. Sometimes there's like 3, sometimes there's 2, and it's a lot of times, and correct me if I'm wrong, it's not agency specific. It's just like the trend of what that MAC is doing at the time. For example, like 10, 15 years ago, they did one site visit only. Now they're doing multiple site visits at different times of, of your enrollment process to, what are they looking for when they're doing a site visit?
Sure. So just real quick to touch on the multiple site visits throughout the process, I will say for me, at least what I see, those are typically rare. Those are usually going to be when there's some sort of issue, at least in the enrollment portion.
Gotcha.
I have seen them though. So it's not to say they never happen, but there is still typically just going to be one site visit before provider.
Oh, interesting.
However, like I said, there can be others.
But
Just
before it was
depending
like
on their-
you applied, you got a site visit, then another time you got a site. Oh, that's the capitalization.
Yes.
Gotcha.
So home health have to show proof of funds in their bank accounts through their capitalizations. They call them capitalizations requests 3 to 4 times throughout the enrollment process. You can have a request for a site visit during that first capitalization. But again, that's usually only for an issue.
I see. Gotcha.
And then second capitalization, I have never seen a site visit ordered at that time because they're just re-verifying the bank funds.
Gotcha. Okay.
But third capitalization, it is mandatory that there is a site visit. That is part of the third capitalization.
And the third capitalization comes after the provider number?
Comes right before the provider number.
Before.
So this is a requirement to receive your provider number.
Is there a fourth one now?
There is a fourth one after you've received your provider. These are inconsistent, quite honestly. I feel like that's always kind of been the case. Sometimes they'll happen about 3 to 4 months after they receive provider. Sometimes they happen like a year after.
Gotcha.
So it really just is keeping an eye out for that request.
Okay. So what are they looking for? And I don't mean like, what are they checking in their list, but like, why do they do these site visits?
They're doing these to make sure that the location is where it is at and that it is open and operational.
What is operational mean?
Operational means that it is functioning, it's open. People, the public can come to the location if needed and see an open business.
So this actually comes from CMS rules towards site visits, where the phrasing is that the public can access the office where services are provided or whatever, but site visits actually happen on all or almost all kinds of healthcare facilities that are applying to Medicare.
Yes.
And so sometimes the phrasing is kind of like general to accommodate, like, for example, like a hospital or something like that, where there are services being performed on site. Like with home health and hospice, the services are actually performed off site, right? They're performed in the patient's home or residence. Whereas with other facility types, there are services on site. And so what they're looking for is operational status, right? And meaning that someone is there, they can access records if they need to, like a surveyor can access records if they need to, which is interesting because when the site visit happens, a lot of agencies who are in the enrollment process don't consider, like, or the owners don't consider them operational. And we've run into some issues with that, right?
Yes. So a lot of times people are waiting to bill Medicare. They are a home health that wants to bill Medicare because that's where they have patients. And you cannot do this until you have your provider. It is very costly to pay your staff, your clinicians out of pocket to do all these visits and do all this care until you can bill. So many agencies choose to wait until they have received their provider to
Actively start going to the office, like every day, like a job, you know?
Exactly.
And that's fully understandable because especially in California, like in other states, it's a bit of a different process, especially if there's no licensure. So you don't have this like upfront couple of years where you're just like sitting, the office is just sitting empty, waiting for applications to be approved to go to survey. And so in California, you have a lot of like empty offices that are just waiting for enrollment application approval from the California Department of Public Health. they are very backed up. And so this is like at this point, what, a 1.5-year process just to get it looked at or something.
Least, yeah.
Yeah. So, and you know, no slack to the health department. They have a lot of things going on, so we get it. But it is ultimately like a 1.5 years or a year, whatever, you know, whatever the time frame is of the office just being empty because they can't legally work
Right.
until you're licensed. And so that's just what happens. Then they're licensed and then they apply for Medicare enrollment. And now we're talking about site visits. But the funny part is that until you get the approval for the enrollment, you can't go to approval for your Medicare enrollment application. You can't go to your second survey. So you're technically probably not even like, you might start admitting patients for that second survey, but like chances are a lot of agencies don't admit patients until like they have their NGS approval or, you know, their MAC approval, because of how long the process is. And I don't know about other states, but like in California, like Kelly said, there's several capitalization required, like vid checks multiple times sometimes. There's also like a extended fingerprinting process with a background check. So your NGS application can actually get rejected like for a variety of reasons. So agency owners oftentimes like just are not like at their agency every single day until they have the ability to work. Because even if you're accepting those couple of patients, you know, for hospice it's 5, for home health it's 10.
It's not 8 hours of work.
It's not 8 hours. It's not close to 8 hours. And in today's technology driven environment, like no one's really coming to the office. Like back in the day, nurses would come and drop off their documentation. Everything's online now. I mean, you know, so there's really like very few reasons for people to just pop into your office if you're not fully operational. So people don't realize that they need to sit in their office because, as Kelly had mentioned off camera, once you are licensed by the health department, they assume you are active and they expect you to be there during your hours of operation. Do you want to go into that a little bit more?
So once you are licensed in the state of California, you are technically operational. You are able to bill for private insurance, and some agencies choose to fully operate that way.
Or Medi-Cal or private pay.
There's different ways you can go about it, not going through route of getting your provider number and doing your Medicare application. So that is why the health department has to view anyone who has their license as operational. Being that these agencies that are applying for their provider number have to be licensed, that means people would have to be in the office. The office would have to be open and operational because you are telling both Medicare and the health department you are.
Sometimes people ask us like, oh, do I need to sit at my office? Do I have to be there and things like that? So it's kind of like a tricky question. The legality aspect of it is, yes, you should be there.
During your business hours.
During your hours of operation. So what happens during a site visit?
So there is an outside independent contractor that CMS has come and look at the signage that is on the door of the agency. Has to match exactly as the application was submitted.
As in like every comma period?
No, but the unit has to be the unit number, that type of thing.
But like, will it be a problem if your company is like Another Home Health Inc. and you put Another Home Health?
Yes. Okay. Yes. Has to be your legal name on the door. You can have your DBA on the door if you have an approved DBA, but that is what has to be on the door.
As in, if you have like, if in your application you have specified the DBA, correct, and you have the registration,
correct,
for it already.
This has to be approved through your application to Medicare.
You can't just like make up another name, put it on it.
Correct. They're verifying that there's no other businesses in that location. That's part of this as well.
For HIPAA.
And they are verifying that the business is open and operational. So somebody is there, and they are able to access the company. What do they actually physically do is they take pictures. Pretty simple. Sometimes they will say hi. Sometimes they won't. So I try to advise people if they are at a point where they're expecting this visit, to let your staff know, first of all, so they know what's going on.
Yeah.
But also, if you can, leave your door cracked or open so that you know when they actually come. So just less stress off of you in general, that you know that they've come and everything's okay. They're taking pictures primarily of the door and the signage at the door, but they might also take pictures further outside of the building, maybe at the entrance of the building, or maybe just a quick snapshot of inside the office as well. But they're not going to be looking through files, going through in any kind of a detail or anything like that. Typically, this all happens within about 2 minutes, maybe maximum. It's very fast. So sometimes they can even come and you wouldn't even know that they had come.
Yeah.
Finished.
If your door is closed, so they have this little app that they like use for this. And part of it is they have to take the pictures through the app. And then they like choose like options of like they were on site and it was operational versus like not there, whatever. So that leads me actually to the question, what happens if you're applying for enrollment, so it's not super active, it's not like you have 50 patients or whatever, and it's one person sitting in the office because you might not need more than that at the moment, and they go to the bathroom right when the site visit comes. Like what can happen? What do they do?
Yeah.
Like what goes on at that point?
So typically they're going to come back at least once to try to catch somebody again. Most situations in an office are not secure enough where you're not going to leave your door open when you go to the restroom.
Yeah, don't do that.
So usually I will tell people to make sure to have, anytime you leave the office for whether it's 5 minutes or for your hour lunch or whatever it happens to be, put something, maybe I will be back at X time on the door, or a little sign saying stepped out for lunch, be back at 1. But the thing is, if you say that, you have to be back from your lunch on time at 1.
Because they might come back.
Because they might come back exactly at 1. So whatever it says as your hours on your door sign, because that is part of the requirement, your hours have to be posted on your door sign. Those are the times in which they're expecting somebody to be there. If it is during that time, let's say 10 to 4 p.m., 10 a.m. to 4 p.m., somebody has a lunch scheduled from 1 to 2, they don't know that.
Yep.
So you would have to put something outside on the door saying, out to lunch, we'll be back at 2 p.m.
And like big pro tip, leave a phone number there.
Absolutely.
They will often call the number because there are situations where the bathroom might be in the office.
Yeah.
You might not hear a knock.
Absolutely.
So leave a phone number if you are going to step out. They will call. Oftentimes, I don't know about every time, but like we have heard that they do call.
Yes.
And they can like say, I'll be back tomorrow or something like that. Like they'll let you know, they're people, they'll just talk you through whatever the situation is.
Now, they are independent contractors. So this being said, this is not a hard and fast rule. They are individuals. This is not a mandatory thing that they must do. So each person can have a different process and treat each situation differently. So you just want to be as available as you possibly can, so that way you're not missing anybody.
Yeah, just be there. Especially because if your site visit gets denied and then they try again and you're again not there, now you're like reapplying, right?
Absolutely.
You're reapplying to Medicare. There's a fee to this. I mean, what's the Medicare application fee now? Like $800 something?
Yeah, it's $730 now this year.
Okay, so you're gonna have to like pay that again. It's again, time's gonna take. I think maybe there's a fingerprinting. I don't know. Like it's like a whole process to just do this.
Yeah.
So if you have gotten a notice to that you're getting a site visit, just sit there until you get the approval. Like just sit there, and that's that.
Yep.
Sit there anyways. But
So who needs to be in the office? I often get asked, does it have to be a clinician? Does it have to be the owner of the agency? No, absolutely not. You can have any staff of the agency whatsoever. So that you can have a what do they call it nowadays?
receptionist, intake, whatever.
Sorry, I'm showing my age.
Entry level staff member.
But you can have the person who is there to answer the phones. That is, if they are a staff member of the agency, that is perfectly acceptable. They don't have to have clinical knowledge or anything like that. Again, as long as the agency is open.
Yep.
That is what counts.
So what happens after the site visit?
So after the site visit, like I said, I mentioned about having the door open so you can know that they came, because a lot of times they'll be sneaky and quiet and just do their thing and take their pictures and then leave. So you'll either get an approval or a denial. So you want to know that everything went well. And so you're not anticipating some kind of a denial down the road. Mm-hmm. As you said, denial can put you all the way back to having to restart your Medicare application and potentially having your accreditation survey over again.
Oh yeah, so that's like a little funny thing.
Yeah.
If it's the first site visit, wait, we said there's one site visit? I don't remember. What did we say?
So
I already forgot.
Typically, there is one site visit, and it is
At
to
the
get
end.
your provider at the very end. So this is like the literal last thing. You've gone through all this time, all these hoops, all this money, and all you have to do is sit in your office and wait for them to come and take pictures of your office.
Yeah, like just do it, because
This is the silliest thing, to get all this hard work and time and money wasted over literally just not sitting there.
so that means you've done your second survey already, your Medicare accreditation survey, and now you have to redo it. And that sucks.
Yes, very much.
Yeah, that really sucks.
This is very costly, very time consuming. Nobody wants
it's
this.
going to set you back like 6 months minimum if you fail this very basic thing of just sitting in your office.
Minimum. And that's if you don't have to redo second survey.
Oh,
Minimum. So yeah, and that's not to mention the fees. So anyway, point being,
oof. Do the thing.
do the thing. Sit there and wait for them to come and take pictures and give you a thumbs up.
Yeah. So the way that you'll ultimately know if you never see this person come and take pictures, like sometimes you're not in the office and they just take pictures of the outside of your door, and that happens too. Mm-hmm. But it could happen that your whole process screws up, and so like it's better to just like do it right. But the way that you ultimately know if you pass or fail is when you get your provider number or whatever they somehow,
Yes.
the provider number.
Provider number. And I say provider number because they will confirm for home health your third cap. That has nothing to do with the site visit.
Yep.
They're just saying, we got your documents.
Yeah, not
a
we
thing-
came and saw it.
Not the site visit's okay too. So that everything, you could be like, great, I did everything I showed the money in the bank, everything's good, chugging along, and then you failed your site visit.
Wah, wah, wah. Don't do that. Just do it. So that's that. That's about the site visit. We joke about it because there have been some unfortunate experiences in the past that we had to like appeal, fight off, and stuff like that. As everything with government, do not get to the point of appeal. It's much harder on that end. They really don't want to appeal it, grant your appeal unless there's like overwhelming evidence that you were right. So just like do not ever assume that you could just appeal something or that it's going to go through. So definitely, please be careful if you're doing a location change or an enrollment application. Please make sure that once you get that the site visit notification from the following morning. Somebody is there. I mean,
Same day.
same day.
I've seen them come same.
Okay, so because essentially what happens is that site visit request appears in that person's app, the CMS contractor.
Right away.
And so if they're close by, they might just like
Swing by.
pop in. So you might get the letter and they might get that request like in that same moment. And they might be like in the next door building and they'll just come by. So the minute you get that, make sure someone's in there. At that point, someone should be in there anyways, realistically.
Yeah.
Like you're like literally 1 minute away from getting your provider number. So it's not like it's the start of the process where it's like 3 years of an empty office kind of thing. So just definitely be at the office, especially if you're doing a change of location for an active agency. Like, do not mess with that. Once you have your provider number, somebody needs to sit there at all times. So some key takeaways: site visits seem minor, but they have really bad consequences if you fail them. Just do it. Don't rely on exceptions or appeals here. They are unannounced but expected, and they're not checking for anything but that, like, the office is there and you're in it. So like, and that there's a sign on the door saying the office. We will have an associated article to this. The article will have a list of what your sign should include to pass this site visit. And that's about it. This is on Medicare site visits. I am Mariam Treystman. This is Kelly McCarthy from the Home Health Consultant. And again, thank you for watching. And if you like our content, please like, subscribe, and share. Bye.